Understanding HIV/AIDS, Epidemiology and Clinical Features. Let's examine the global impact of HIV/AIDS. In 2023, approximately 39.9 million people were living with HIV globally. There were 1.3 million new HIV infections and, tragically, 630,000 AIDS-related deaths in 2023. It's important to understand the distinction between HIV and AIDS. HIV, or human immunodeficiency virus, attacks the immune system, specifically targeting CD4 T cells. AIDS, or acquired immunodeficiency syndrome, is the advanced stage of HIV infection, characterized by a severely weakened immune system. Here we can see how HIV enters and infects a T cell, beginning the process that can eventually lead to AIDS if left untreated. HIV transmission occurs through specific routes. It's important to understand both how HIV is and is not transmitted. HIV is primarily transmitted through unprotected sexual contact, sharing needles, contaminated blood products, and from mother to child during pregnancy, childbirth, or breastfeeding. It is not transmitted through casual contact like hugging, sharing food, or using public facilities. HIV infection progresses through several distinct stages if left untreated. The acute phase occurs shortly after infection and may include flu-like symptoms. This is followed by a chronic, often asymptomatic phase that can last for years. Without treatment, HIV eventually progresses to AIDS, characterized by severe immune deficiency and susceptibility to opportunistic infections. As HIV progresses and CD4 T cell counts decline, people become vulnerable to opportunistic infections. The risk for specific opportunistic infections correlates with CD4 cell count levels. As counts drop below critical thresholds, the risk for more severe and life-threatening infections increases. While global trends show overall progress in combating HIV/AIDS, the WHO Western Pacific region presents concerning trends. Since 2019, new HIV infections in this region have risen by 8%, and AIDS-related deaths have increased by 10%, reversing years of progress. This highlights the importance of maintaining and strengthening HIV prevention and treatment efforts.